Okay, Assalamualaikum, selamat pagi. Saya Dr. Badri Syam Abdul Rahman, Ketua Produk Penyelidikan dan Pembangunan Produk Pharmanega. Bersama saya ada 3 lagi panel untuk sesi latihan kita pagi hari ini, pendedahan terhadap produk CoronaVac. Ya. Di sebelah saya Dr. Ajit Pal Singh, dia adalah vaksin expert, tetapi Dr. Ajit berasal daripada India, jadi persoalan dalam bahasa Inggeris saja untuk dia, nanti kita cuba translatekan kalau ada keperluan. Dan bersama saya juga ada Puan Vanessa Daniel, Deputy GM Clinical Affairs and Pharmacovigilance, dan Encik Johan Jaafar, dia Senior Manager bagi Logistik and Distribution. Jadi kami boleh jawab persoalan berkaitan dengan produk COVID-19 vaksin keluaran CoronaVac China. Ya. Produk ini dinamakan CoronaVac dan kita akan ada pembentangan selama 1 jam termasuk sesi soal jawab berkait dengan produk inilah. Bermula dengan kita nak cakap sikit pasal teknologi vaksin tersebut, clinical data, kemudian kita cakap tentang vaksin attribute dan kaedah pemvaksinan. Lepas tu kita akan sambung kepada post vaccination pharmacovigilance activities dan juga packaging and distribution. Saya akan proceed dengan slide ya.
Yang pakai.
Okay. Buka slide.
Ini hilang nggak?
Image kita akan
You tak mau image kami kan? Ya. Boleh. Like this lah. Okay, ini saya rasa boleh. Okay.
Boleh nampak slide?
Itu mute. Tolong mute.
Mute kan? Okay, boleh saya mula ya? Next slide. Okay, produk kita bernama CoronaVac, ya. Dan mengikut agenda kita akan berbincang pasal vaksin, sedikit tentang data clinical trial, attributes of the vaccine, kaedah pemvaksinan, post vaccination activities dan juga packaging and distribution. Kami berempat akan berkongsi ya, membentangkan slide yang berkaitan. Next. Bermula dengan COVID-19 virus vaksin teknologi ni. CoronaVac ni vaksinnya berasaskan kepada inactivated viral particle. Ini adalah formula vaksin yang biasa di mana virus dihidupkan dan diekstrak daripada proses penghasilan virus tersebut. Seperti teknologi ini adalah teknologi yang dah lama dan biasa digunakan termasuk untuk vaksin jenis IPV dan juga hepatitis A. Vaksin ini digunakan kaedah inactivated dan adjuvanted untuk menghasilkan antibody. Virus ni diasingkan daripada Wuhan outbreak dan dikaji pada pelbagai peringkat. Ada pelbagai jenis kaedah bagaimana kita boleh gunakan formula vaksin, tetapi seperti yang saya kata, CoronaVac menggunakan the entire virus particle ya, yang telah di-inactivated sebagai formula vaksin. Okay, next. Sedikit pasal kajian klinikal, preclinical. Kajian di peringkat haiwan di GLP lab di China as per the WHO requirement melihat kepada toxicology terhadap haiwan, anaphylaxis, immunogenicity dan juga animal challenge, di mana single dose vaksin telah digunakan diuji kepada tikus dan juga guinea pigs. Dan ujian diulang untuk melihat dose toxicity. Kita melihat 3 dos yang berbeza ya. Lepas tu kita juga melihat kepada kaedah tindak balas anaphylaxis terhadap rats and monkey, dan juga peningkatan dos terhadap kesan immunogenicity terhadap 2 jenis spesies haiwan, with and without adjuvant. Dan juga di akhir sebelum kita uji kepada manusia, kita lakukan animal challenge di mana virus tersebut telah diekspos kepada rhesus monkey ya, untuk melihat dos klinikal. Next. Secara umumnya, ini adalah kajian klinikal yang telah dilakukan selepas diuji kepada manusia. Kajian fasa 1 dan 2 dilakukan di China untuk melihat dose tolerance terhadap adults, dan fasa 2 juga dilakukan untuk melihat dose schedule dan immunogenicity. Kajian melibatkan 177 adults pada peringkat fasa pertama. Pada fasa kedua, selepas melihat kepada safety profile of the vaccine, ujian disambung kepada elderly dan juga children. Yang diuji kepada hampir 2,000 volunteers ya, dan telah membuktikan tahap keselamatan dan immunogenicity formula vaksin tersebut. Dari segi kajian dos, ia telah diuji kepada sehingga 3 dos, tetapi pada peringkat kajian klinikal ke tahap ketiga, kita lakukan pada 2 dos schedule ya. Dan kajian dilakukan pada dos bersela di antara 0 hingga 14 hari dan juga 0 dan 28 hari terhadap 3 populasi tersebut, iaitu adult, elderly dan juga children. Data untuk fasa 1, 2 dan 3 telah lengkap untuk kesemua kategori umur tersebut ya. Dan fasa ketiga telah dilakukan di Turki, di Brazil, di Indonesia dan di Chile. Lebih kepada untuk melihat safety and efficacy of the formula of the vaccine, dan diuji terhadap adult umur 18 tahun ke atas sehingga dewasa pada umur 90 lebih ya. Dan dari segi safety efficacy-nya menunjukkan tahap keberkesanan dan keselamatan yang tinggi, yang mana saya akan detail out later sedikit. Dan yang paling penting, secara umumnya di Turki, overall kajian adalah kepada general population dengan efekasi pada tahap 83.5%, dan 100% daripada volunteers yang menerima vaksin tidak memerlukan hospitalization. Sama juga di Brazil, walaupun overall efekasi nampak lebih rendah pada 50.38, tetapi kajian adalah pada 100% kaki tangan hospital yang sehari-harian di 16 institut atau hospital yang dealing with COVID patients ya. Jadi mereka adalah lebih terdedah kepada jangkitan, tetapi jangkitan adalah pada tahap yang agak ringan, mild ya. Dan efekasi pada tahap tanpa memerlukan medical care adalah pada tahap 77.9%, dan 100% volunteers yang menerima vaksin tidak memerlukan hospitalization. Dan kajian di Indonesia lebih kepada melihat konsistensi lot to lot produk yang dihasilkan, dan untuk melihat keberkesanan vaksin tersebut lebih daripada 6 bulan ya. Dan untuk melihat pada kualiti immunogenicity pada tahap 96, 97 dan 98%, bermaksud setiap batch yang berbeza berupaya menghasilkan immunogenicity yang diharapkan ya. Dan pada tahap interim efficacy adalah pada 65.2%. Okay. Dan kajian yang dilakukan di Chile adalah susulan kepada yang dilakukan di Brazil, di mana 3,000 volunteers adalah kesemuanya adalah kaki tangan hospital yang dealing dengan pesakit COVID. Mereka juga untuk melihat tahap keberkesanan special population tersebut ya. Kajian masih berjalan di Chile, tetapi kajian di Turki, Brazil dan Indonesia telah lengkap ya, yang boleh kita share sekejap lagi. Okay, next. Sedikit tentang kajian klinikal fasa 1 dan 2 di China. Ini pada peringkat awal pandemik COVID-19, keadaan agak teruk di China, dan selepas kajian praklinikal dilakukan, kajian dilakukan untuk pelbagai 3 kategori umur. Dilakukan kepada adult umur 18 hingga 59 tahun. Kajian ini telah lengkap. Mereka melihat kepada dos yang berbeza, 300 dan 1200 CoronaVac unit dan juga placebo. Lebih kepada melihat safety dan immunogenicity. Dan kajian diteruskan kepada peringkat elderly, umur 60 hingga 89, dan dos dikurangkan kepada 300 dan juga di-maintain pada 600 dan 1200. Dan kajian juga selepas melihat safety profile pada dewasa dan elderly, kajian disambung untuk peringkat kanak-kanak. Kajian ini juga telah lengkap. Kami telah dapat data dia semalam, tetapi pihak CoronaVac China baru menghantar submitted the data untuk regulatory review. Dan ujian dilakukan pada dos yang rendah pada 300 dan juga pada 600 SU unit, berbanding placebo. Secara kesimpulannya, excellent safety and immunogenicity profile. Tidak ada perbezaan perbandingan di antara yang menerima vaksin dan juga placebo dari segi safety-nya. Next. Dari segi immunogenicity results, pada dos 014 dan dos 028 hari, kalau kita lihat bar chart ini menunjukkan antibody yang terhasil, seroconversion of the antibody mencapai hampir 100% selepas 14 hari pada dos kedua, dan sedikit peningkatan selepas 28 hari jika selama suntikan kosong 14 hari. Tetapi jika kita menggunakan dos semasa kosong 28, data yang ditunjukkan adalah lebih baik, antibody yang terhasil jauh lebih tinggi. Tetapi untuk kedua-dua dos, dua dos yang sederhana dan juga dos yang tinggi, tidak ada significant difference between different dose tersebut. Dan pada peringkat kajian ini dilakukan, pandemik COVID-19 adalah tahap yang tinggi. Jadi panel telah mencadangkan fasa ketiga dilakukan pada sela yang lebih cepat, iaitu 0 hingga 14 hari untuk dos kedua. Tetapi sebenarnya jika dilewatkan sehingga 28 hari, antibody yang terhasil adalah lebih baik, sedikit lebih baik. Tapi memandangkan keperluan yang mendesak pada keadaan pandemik COVID-19 pada tahun 2020, kajian klinikal telah mencadangkan sela masa dos untuk 14 hari dilakukan. Okay, next. Dan GMT ataupun geometric mean titer of the antibody were measured di antara sela masa 014, sela masa 028 hari, adults dan juga elderly. Ini menunjukkan geometric mean titer of the antibody adalah tinggi dan slightly higher apabila sela masa 028 hari immunization dilakukan. Next. Okay, sedikit bagaimana kajian klinikal dilakukan. Populasi umum, volunteers yang berbeza bagi peringkat fasa 1, 2 dan 3 dan di pelbagai negara yang terlibat. Tetapi konsep yang sama dilakukan. Study intervention, dari segi definition, kita suntik vaksin, which is an active substance known to protect against virus. Sebahagian daripada volunteers menerima placebo. This is double blind randomized kajian yang dilakukan independently. Jadi doctors dan juga volunteers tidak tahu sehingga data akhir dikongsi, baru ditahu siapa yang menerima vaksin dan siapa yang menerima placebo. Study outcome lebih kepada melihat simptom jangkitan COVID seperti demam dan chills, batuk, kesukaran bernafas, fatigue, sakit-sakit sendi, muscle dan parts of the body, pening kepala, kehilangan upaya untuk deria rasa dan bau, sakit tekak, nasal congestion, nausea ataupun muntah dan diarrhea. Jika volunteers ini mengalami simptom-simptom seperti yang tertulis tersebut, mereka akan diuji dengan PCR untuk confirm sama ada mereka dijangkiti dengan COVID-19. Ya. Jadi efekasi adalah bagaimana ukuran membezakan di antara yang terjangkit dengan yang tidak terjangkit bagi dua populasi yang berbeza tersebut, iaitu sama ada mereka menerima vaksin ataupun placebo. Ya. Next. Okey, secara umumnya tadi saya dah describe secara general. Kajian yang dilakukan di Turki telah lengkap, efekasi pada 83.5%. Ya. Kesemua vaksin telah dihasilkan di China dengan lot batch yang sama, diuji di Turki, Indonesia, Chile dan juga Brazil dengan kadar efekasi yang tertera. Di Indonesia, seperti saya sebut tadi, kajian ada lebih kepada stability dan juga untuk 6 bulan vaccination dan juga batch yang berbeza. 3 lot batch production telah diuji di Indonesia. Di Chile juga diuji untuk pekerja hospital termasuk nurse dan juga doctors. Dan di Brazil, ini yang sebenarnya selalu dihighlightkan pada 50.4. Seperti saya katakan, clinical settings ni adalah special. Dia bukan general population tetapi 100% volunteers adalah di Brazil. Pada keadaan tersebut, tahun 2020, healthcare professional di Brazil hampir collapse. Ya. Mereka terdesak untuk mendapat vaksin dan telah bekerjasama dengan Sinovac untuk melihat setakat mana keberkesanan vaksin tersebut untuk mengurangkan jangkitan. Jadi, efekasi tersebut pada 50.4 telah membuktikan bahawa reduction of infection terhadap kaki tangan hospital yang hari-hari dealing dengan pesakit COVID. Ya. Dan sample size of 13,060 orang yang berumur 18 tahun ke atas telah menerima vaksin ataupun placebo. Next. Data yang kita, okay. Corona vaksin, okay. Persoalan, jika ada soalan kita akan jawab di penghujung sesi ini. Untuk itu ada tadi berkait tentang clinical and R&D work. Saya serahkan kepada Puan Vanessa untuk sambung sedikit pasal attributes of the CoronaVac vaccine. Ya. Silakan.
Okay, terima kasih Dr. Bat. Okay, selamat pagi semua. So kita akan bincang sekarang tentang ciri-ciri CoronaVac ya. So next slide please. Okay, so kita tengok first attributes, ciri-ciri The first thing is komposisi produk ini mengandungi of course antigen SARS-CoV-2 dan excipientnya adalah excipient yang biasanya ada dalam most vaccines, iaitu aluminium hydroxide, hydrogen phosphate, sodium chloride, sodium hydroxide dan water for injections. Tak ada preservatif dalam produk ini ya. Warna dia putih dan mungkin ada beberapa lapisan endapan untuk produk ini, tapi dia akan hilang selepas digoncang. Okey. Indikasi CoronaVac adalah untuk individu 18 years of age and older. Walaupun kita ada kajian klinikal untuk warga tua berumur sehingga 89 tahun, tetapi bila nak memberi vaksin ini kepada orang yang berumur kepada warga tua, it has to be done with caution. ya, memandangkan mungkin warga tua ada comorbidities. Ya. Okey. For presentation, satu pack ataupun dalam satu carton, produk ini ada 40 vial. Ya, and perlu diberi selepas dos pertama, dos kedua perlu diberi dalam 14 hingga 28 hari. Okey, satu dos adalah dalam 0.5 ml. Okey, next slide. Okey, kita dapat banyak soalan tentang storage and stability. So, vaksin ini stable dalam package insert between 2 to 8 degrees. Jangan disejuk bekukan. Okey, dan perlu digunakan immediately selepas dibuka. Ya. Tetapi kalau ingin menggunakan vaksin ini pada we have stability, vaksin ini stable sehingga 25 darjah Celsius. Ya, dan sebaiknya guna dalam hari yang sama, within the same day. Okay, next slide, administration. Okay, CoronaVac should be administered via intramuscular injection di deltoid region of the upper arm. Perlu digoncang sebelum guna. Inspect visually, kita kena tengok sama ada benda asing. Kalau ada benda asing, jangan digunakan. Again, vaksin ini perlu digunakan sebaik saja dibuka, ya. Okay, next slide. This is the vaccine administration. So the deltoid arm just above the level of the armpit, below the look at the diagram here. We have, yeah, the needle size is 22 to 25 gauge. Yeah, and use a needle long enough to reach deep into the muscle. Needle at 90 degrees angle to the skin with a quick thrust. Separate 2 injections given in the same deltoid muscle by a minimum of 1 inch. Okay, next slide. Okay, now we go to contraindications. Siapa yang tidak boleh menerima vaksin ini? Kalau individu yang hypersensitivity atau ada allergic reaction kepada apa-apa komponen vaksin ini, perlu di-contraindicate, okay? Ataupun individu yang pernah ada allergic reaction previously seperti anaphylaxis, angioedema, kita perlu contraindicate. Individu yang ada neurological conditions perlu di-contraindicate. Mereka yang ada severe chronic disease perlu di-contraindicate, dan juga wanita yang pregnant dan lactating buat masa ini perlu di-contraindicate kerana belum ada data clinical trial yang complete, ya. Okay, next slide. Okay, warning and precaution. Maklumat ini banyak, semuanya boleh diperoleh daripada package insert. So in general, for warning and precaution ni, kita perlu memberi supervision and treatment for those who might have anaphylactic reaction. So as per normal clinical setting, selepas vaccination they should be observed for 30 minutes. Including for those anxiety-related reactions macam sinkop, ya. And of course for individuals with acute diseases, kita perlu administer with caution, ya. And kalau perlu, please delay upon the doctor's assessment. Next. Okay, so individuals with diabetes, convulsions, epilepsies, or history of mental illnesses, these should be given with precaution, again based on doctor's assessment lah. Yeah, let's go. Okay, those taking human immunoglobulin injections and those immunodeficient individuals will also have to be given with cautions. Next. Okay. Finally, do not mix CoronaVac with other vaccines in the same syringe. Avoid exposure of CoronaVac to disinfectants before use. Don't freeze. And with any vaccine, yeah, the protective effect of CoronaVac may not reach 100% for all recipients. Okay, adverse effects very general untuk vaksin ini. Tak ada yang terlalu serius, ya. Biasanya yang common adalah pain, swelling, erythema and induration burning sensation in the site of injection. And mostly after injection would be headache and fatigue and sometimes fever. Yeah, next slide please. Okay, interactions with other medicaments should be careful because at the moment there's very limited data on interactions with other medicaments. So please, with caution. Next slide. Okay, and we come on to AV management, adverse events following immunization. Yeah. Okay, seperti semua orang tahu, kita perlu report semua adverse event kepada National Center for Adverse Drug Reaction Monitoring Center. So, mesti report for minimum criteria untuk 3 types of AVs, serious AVs, vaccine administration errors AVs, and non-serious AVs. And for the forms, please look at the blue form, borang biru yang biasanya ada dalam website NPRA, ataupun borang pemantauan kesan adverse susulan imunisasi. Next slide. Okay, borang-borang boleh disubmit online. Kalau tuan-puan dan puan-puan pergi kepada website NPRA under Health Professionals, Reporting ADRs, you can submit your forms there. Okay, so information berkaitan dengan AV ni perlu diberi kepada NPRA, tetapi Pharmaniaga mungkin contact tuan-tuan dan puan-puan, and if we need some information, mungkin this is because we would need to do the safety analysis for the product. So we really appreciate your cooperation for this. Yeah, and if you need further information, you will be provided with the CoronaVac package insert dengan fact sheet. So please read, and all the information that you need is in there. Okay, next slide. Okay, selepas vaccination, semua vaksinis akan diberi vaccination reminder card. Card ini dalam 2 bahasa. So next slide, we can look at the vaccination card terus. Okay, so this is the vaccination card. Di sini kita ada dos pertama dan dos kedua, information on tarikh vaksinasi, facility, batch number dan juga tarikh luput. Semua information ini perlu di-key in ataupun ditulis ya. Also with the number and passport number or nombor kad pengenalan of the vaccinee. Also important would be the tarikh temu janji dos kedua. Then for most vaccination cards ni, not for all vaccination card, kita ada QR code. So QR code ni adalah untuk remove ataupun package information leaflet ini adalah untuk vaccinee, mereka boleh scan to get more information regarding the vaccines. Yeah, next slide. Okay, ini muka kedua BRC vaccination reminder card. Dalam muka kedua kita ada possible side effects ataupun kesan sampingan dan cara menguruskan kesan sampingan ini. So these are all the common kesan sampingan yang akan mungkin dialami oleh vaksinis lah. Semuanya tak begitu serius. Kalau serius lebih daripada 48 jam, perlu jumpa dengan doktor immediately. Okay, next slide. Okay, ini just to give you an information on idea of what the QR codes are, seperti yang saya cakap tadi. It is for patient information leaflet dalam English dan untuk bahasa Melayu, risalah maklumat ubat untuk pengguna remote ya. Okay. Next slide. Okay, so I will pass this back to Dr. Bat. Thank you.
Okay, kami menerima soalan. Kita akan address soalan-soalan ni di penghujung. Kita proceed dengan Cik Johan dulu untuk pembentangan berkaitan logistik dan distribution. Di penghujung kita akan jawab segala persoalan. Thank you. Proceed to you.
Okay. Assalamualaikum dan salam sejahtera. So saya will proceed dengan pembungkusan and juga distribution of this vaccine. Next slide please. Okay, seperti yang kita tahu, untuk makluman kita dah receive penerimaan 100,000 of finished goods from CoronaVac. So the process is the same. Kita maintain all the temperature apabila kita menerima daripada pihak pengilang, and then penerimaan dilakukan di KLIA. And then after that kita membuat penghantaran ke pusat simpanan iaitu Farmaniaga Logistik Bukit Raja, dan proses lot release adalah diselenggarakan oleh pihak Farmaniaga dan juga pihak MPRA Malaysia. And then after all the release settle, and then now untuk masa sekarang kita dalam proses akhir untuk membuat distribution ataupun delivery ke pusat-pusat yang telah disenaraikan, ke pusat-pusat PPV dan PPV yang telah disenaraikan oleh Kementerian Kesihatan. So untuk makluman, cara penghantaran adalah seperti yang kita praktis ataupun sebelum ini dengan Kementerian Kesihatan, iaitu akan menggunakan our own facility dan juga cara pembungkusan yang sama. Next slide please. Okey, seperti yang kita sedia maklum, Farmaniaga memang membuat penghantaran cold chain produk menggunakan our own customized foam box ya. Untuk COVID untuk this vaksin kita menggunakan 3 size kotak yang telah di-validate ya, based on our own configuration ya, iaitu M, L dan juga XL. So berdasarkan senarai yang telah kami terima, pihak logistik terima, berkemungkinan kebanyakan penghantaran akan dilakukan dalam saiz M dan juga L ya. So dan kuantiti yang ditertera di slide iaitu 240 vial, 480 vial adalah kuantiti maksimum yang boleh dimuatkan ke dalam kotak tersebut ya. And then the cooling component yang kita gunakan adalah menggunakan gel, ice gel yang kita telah tetapkan, unit yang telah ditetapkan berdasarkan validasi yang kita telah lakukan ya. Untuk penghantaran vaksin pada kali ini, Farmaniaga introduce this cheaper outer box untuk memastikan the safety of the foam box dan juga pemantauan ya, untuk cover the foam box itself. So seperti yang telah tertera di screen, few snapshot untuk kotak-kotak yang kita akan gunakan untuk penghantaran vaksin pada kali ini, iaitu berbeza dengan penghantaran vaksin ataupun cold chain product yang telah kita lakukan sebelum ini with Kementerian Kesihatan ya. Next. Okey, untuk setiap kotak yang dibungkus atau di pack, kita akan sertakan cold chain monitor card sebagai indikator untuk memastikan jika berlaku excursion ataupun the temperature inside the box exposed pada suhu 2 hingga 8 C, so ia akan memberi maklumat kepada pihak menerima jika situasi exposure itu berlaku ya. So penggunaan cold chain monitor card ni adalah mudah. Activation akan dilakukan untuk mengaktifkan kad ini akan dilakukan di pihak Farmaniaga. Apa yang perlu pihak PPV lakukan adalah apabila menerima kotak tersebut, membuka kotak tersebut dan memastikan tiada indikator yang kalau kita lihat indikator turn blue, maknanya ada liquid like a dye blue color yang akan show in that window. Apabila berlakunya jika suatu the color blue color show in that window, ia melakukan ada the temperature excursion berlaku untuk penghantaran tersebut ya. So jika itu berlaku, the temperature, maknanya the temperature dalam kotak tersebut telah melebihi 8 C lah. Jika tidak berlaku apa-apa, ia bermakna temperature dalam kotak tersebut memenuhi temperature requirement, iaitu 2 hingga 8 C untuk produk this vaksin. Next. Okey, bersama juga dengan penghantaran sebelum ini ke PTJ, Pusat Tanggungjawab, iaitu there are few important label ataupun stiker yang saya nak terangkan di sini. Satu adalah tarikh dan masa kita membuat pembungkusan di pihak Farmaniaga Logistik, iaitu yang tertera pada gambar rajah nombor 1. Dan kedua adalah security seal yang kita baru perkenalkan, especially untuk penghantaran vaksin COVID-19 ya, iaitu kita akan lekatkan security seal ni untuk memastikan tidak tampered, tiada sesuatu aktiviti tampered yang kotak tersebut. Dan gambaran rajah yang ketiga menunjukkan the snapshot bagaimana the finish of the packing kotak tersebut yang akan terima oleh pihak PPV. Next. Okey, untuk penghantaran ini saya percaya delivery order yang saya tunjuk kat sini adalah delivery order yang biasa dilihat apabila buat penerimaan di pihak hospital. Cuma pada kali ini ada sedikit perubahan. Letterhead adalah letterhead Pharmanega Life Science Pharmanega Life Science, itu Pharmanega Logistik, ya. And then DO adalah sama, kepingan DO adalah sama. And then kita sertakan juga iaitu seperti yang Puan Vanessa mention, vaccination reminder card. Vaccination reminder card ni kita akan sertakan di dalam zip bag, dan setiap kotak of 40 vial akan disertakan 40 keping VCR ni. So kita akan letakkan, tempatkan VCR dan zip bag ni di atas penutup form box tersebut, dan jika apabila tuan dan puan membuka kotak shipper tadi, puan dan puan akan nampak disk card dulu, dan then do the verification next lah. And then pada masa yang sama, apabila kita buat penghantaran menggunakan DO, kita sertakan sekali direct healthcare professional communication, iaitu a letter to mention about the product label notice, iaitu in term of the shelf life of the product. There are possibility expiry date di shelf life di physical is longer than yang sepatutnya di-approve oleh pihak kementerian, iaitu 9 bulan, jika tak silap saya. Yes, yeah. Next. So untuk setiap movement of this product, kita akan register melalui VMS application, penerimaan dan juga penghantaran. Saya tunjukkan di sini just few snapshot, ya, in term of what we are going to scan dan apakah status apabila vaksin itu telah kita buat naik ke dalam VMS application. Alright, next. So this is just a snapshot what we call the standard that we have in Pharmanega Logistik. We comply with our GDP and also GDP MD and also all the ISO required for this setup. Thank you.
Alright, terima kasih kepada pengurutan kita, Dr. Bad, Ms. Vanessa dan juga Dr. Ajit dan Cik Johan. Ada banyak soalan yang akan kita cuba ambil daripada laman YouTube dan juga web chatbot ini. Apa kata kita mulakan dengan soalan yang pertama. Soalan daripada Ms. Sung Hui Ful, the gap between first and second dose should be 14 days or 28 days.
Okay, as per the clinical data, the ideal time to vaccinate second dose is 28. But since the clinical trial has been done from 14 to 28, I think you can plan anytime 28 up to 21 days. So from 21 onwards to 28 days, but ideally it should be on the 22nd day, 4 weeks after first dose.
Next question from Rashida. What's the standard recommended regimen if approved for use in Malaysia?
There are 2 doses to be administered, 0 and 28 day. But ideally you can plan anything between 21 to 28 days after the first dose.
From Ju Zeng Lo, what are the definitions for hospitalization? Any data on prevention of transmission of virus?
Okay, so in the clinical trials, the transmission of virus is still ongoing. However, hospitalization, they have seen that the vaccine protects 100% against any kind of hospitalization. In the Brazil study, they were 100% protected for hospitalization, even for observation. For any kind of medical intervention, the protection is as close to around 83%. Even in the Turkey healthy volunteer study, which is mainly adults, 18 to 59, protection against hospitalization is 100%.
The next question from same person, why there is a huge variation of treatment effect, 95% confidence interval among the study population, and what is the statistical data on efficacy?
So, okay, confidence interval basically tells you that if you repeat this experiment 100 times, where will the statistical or probability of the results fall in? You should actually focus on the point estimate of that particular trial. When we calculate sample size, there are many variables we take into account. For example, attack rate, the disease incidence in population, and what is the risk of population. We should consider, we give importance to the data where the confidence intervals are above, lower level is above 50. So in Brazil, if you look at the efficacy data for hospitalization, the confidence interval is above 50. So that's significant protection. Turkey also, for actual protection, which is 83%, confidence lower level is above 50. So we focus on the lower level of confidence limit, which should be ideally above 50, but anything above 30 is also acceptable as per WHO guidelines.
All right, next question from Ms. Rosnida. Do you have data on asymptomatic infection?
The clinical trials are done in a way that it is difficult to capture asymptomatic. So how these clinical trials are done, efficacy studies, you have a population, you vaccinate with placebo and vaccine, and then you send them back to their houses. When they have any symptom, then only they come back to the hospital and report that they have either cough, headache, myalgia, whatever, and they are tested for COVID positive by PCR. In real life situation, if the population is not coming to hospital every day, like for example doctors, they will not be coming back to hospital for any kind of test because the first point of diagnosis is symptom. So very difficult in efficacy study to detect asymptomatic protection. Also in the Brazil, they were all doctors, but they still have 1 or 2 minor symptoms to be classified as a case. So efficacy studies cannot collect asymptomatic cases for efficacy assessment. You have to have some symptom to become a case.
Next question from Sun Hongfu. CoronaVac contraindicated in uncontrolled chronic illness patient?
Okay. As like any other vaccine, this vaccine was tested in elderly and also with all comorbidities. So in Brazil, the study went all the way up to 84 years of age. In Turkey, however, it was only up to 60, but there were comorbid patients who have diabetes, hypertension, obesity. It can be given with all the comorbidities, but of course, if the comorbidity is in acute phase, you defer vaccination until that acute phase is corrected. Right? For example, if it's uncontrolled diabetes, you look at the diabetes correct and then vaccinate. Or if an allergic patient and he has uncontrolled rash all over the body or some part of the body, then you wait for the rash to subside and then vaccinate. So any acute exacerbation of chronic disease, you have to postpone the vaccination. It's not for this vaccine, it's for every vaccine.
From Yongkang Chia, 1 vial for how many vaccinees?
But this is a single dose vial. So the vial contains around 0.6 ml of vaccine. And when you extract, you should extract as much as possible and then discard anything above 0.5 ml. For the subject, you only administer 0.5 ml. So it's a single dose vial.
From Sun Hongfu, those allergic to community cannot use CoronaVac?
Yes, and I mean, you basically, if you are allergic to another vaccine, it's not contraindication for this vaccine. Of course, any kind of past allergy, food allergy or vaccine allergy, it has to be with caution. So you have to be prepared with all the measures in case it becomes hypersensitivity, and you have to be a little bit more careful and observe them for some extra time.
From Bahani Selvaraju, what is meant by severe chronic disease?
Okay, any kind of chronic disease. For example, you have diabetes, and severe uncontrolled diabetes is ketoacidosis at that point. You are having vomiting and nausea and uncontrolled diabetes, and you have ketoacidosis phase. So any chronic disease has an acute phase and a controlled chronic disease, like cancer. If you are diagnosed with a breast cancer and you have taken your chemotherapy and you are under observation, you can still take the vaccine. But if it is in a progression stage 4, acute phase, you have other systemic symptoms, better postpone until that symptoms are controlled.
Ms. Deborah Ngadan would like to know what is definition of severe uncontrolled chronic disease?
It's not severe, it's basically the acute phase of a chronic disease. Any chronic disease, which could be allergy, diabetes, hypertension. If it's you are in the acute phase, if you are hypertensive and you are controlled with antihypertensive medication, but suddenly that day you have very high, 200 by 100, I mean, you should postpone the vaccination on that day and let the blood pressure come down, settle down, and then vaccinate.
Ms. Sarah Sofian, any history of anaphylaxis with CoronaVac so far?
Okay, in the clinical trial, there has been no case of anaphylaxis, neither in Turkey nor in Brazil. There was one severe case of hypersensitivity, which is a skin rash, observed in Turkey. The post-vaccination data in China have close to 15 million people vaccinated, and there has been an observed anaphylaxis of less than 1 per million. So the data on anaphylaxis for this vaccine is as good as any other killed vaccine in the past, which is hepatitis B or IPV, which is around 1 per 1 million vaccinated.
Aloysia Duan would like to know, is previous tuberculosis patient can take this vaccine?
Yes, of course. I mean, if this not an active tuberculosis, and even if they are taking medication, they can take this vaccine.
Okey, Encik Amir Abdullah Khaid, untuk severe chronic disease tu, perlu tak surat pengesahan doktor so that DM atau HPT is good control? Do you need a verification letter from the doctors so that for DM and HPT is good control for severe chronic disease?
Okay, if you can easily identify whether they are in acute phase. I mean, if they are having headache, if they are having dizziness, if they are diabetic, you ask them whether you are having sweating or you feel, noxious. You can easily detect whether they are in acute phase of this chronic disease. Anybody who walks in, he said, I have a history of diabetes, I'm taking medication, and if it looks okay, I think it can be vaccinated.
From Ivory Jane, does it mean we have to CC the FE report to Pharmaniaga as well?
No, you don't have to CC Pharmaniaga for this. You can report directly to NPRA and the report will be then sent to us.
Next question. Adakah tempoh 56 hari pada suhu 25 darjah Celsius tersebut merujuk kepada time out of refrigerator, maximum allowable execution time? Is it the 56 days on the 25 degrees Celsius refer to time out of refrigerator, the maximum allowable execution time?
Okay, what you saw in your slide is the data from CoronaVac where the accelerated stability was done on the finished product from vial. They have done it on the bulb, on the other presentation like pre-filled syringe, pilot scale vials and the commercial scale vial. So this vaccine is very stable at 25 degrees, close to 2 months. But some of this timing has been used for packaging and storage at that end. So what you have at hand at your site is around 1 day of 8 to 25. So if you have to store vaccine at 2 to 8, and whatever you want to vaccinate, you take out on that day. And if you finish everything that day, it's okay. It should be below 25 degrees under ambient air-conditioned room. The data on putting it back in the fridge at 2 to 8 and then taking it out and how many times you can do that is still under development. The data is not available yet. But what you have at your site is for that particular day, you can take it out from 2 to 8, keep it at 25 until you vaccinate everyone from whatever doses you have taken out. You just take out whatever you need for that day. And keep it at less than 25.
From Afifah Sabjan, do we need to use 2 vaccine cards? The first one is vaccination card and the second one is vaccination reminder card.
I think it's the same card, but in case the subject forgets when he comes for the second time and he forgets to bring the first one, you can use the second one, but preferably better use the same one and ask them to bring the first one so that if your center is vaccinating with few other company vaccines, then it will be easy for you to quickly identify what has been given as a first dose.
Dr. Ajit is right. Ideally, you would be given the vaccination card during the first dose. And if you keep that safely, you just bring it for the second dose.
Right, from Pharmacy KKKL, may we have dimension size of vial and dimension of inner pack box for storage purpose, roughly, maybe?
The vial is a 2R vial, which means it's a 2 ml vial. It's a very small vial, and the box size, we don't exactly remember the dimension, but it's around size of iPhone Pro 12. We don't remember exactly the size, but it's like maybe around 5" by 2" in length and breadth, and the height is around 2.5".
From Pravin Munyandi, how we define the term uncontrolled severe chronic disease? Most of our chronic disease patients are uncontrolled. Do we have a cutoff for each chronic disease in terms of uncontrolled and severity?
Okay, so every disease has a defined definition when it is in the acute phase or when it is in a control phase. So if you take diabetes, hypertension, any chronic, let's for example, a allergy patient, is an allergic to food material, but at that day, he's not allergic, there's no severe rash on his face or arms. It means it's a controlled chronic disease and it can be vaccinated. It should not be in a phase where it has to be actively medicated to control it. Diabetes, of course, is a chronic disease where you have to give diabetic medication throughout, but it should not be in a phase of ketoacidosis for diabetes. That's what it means, acute phase. Hypertension, it should not be in the phase of severe hypertension where the systolic, diastolic around 100 plus and 180 plus. That kind of acute phase.
Ting So Chow would like to know how long can we delay the second dose before we lost the efficacy?
In the clinical trial, they have only tested up to 28 plus 7 days, up to 35 days, and they have seen protection. So what we can say is that you can go up to 7 days window period after 28 days.
Sun Hong Fo, CoronaVac cannot use in pregnancy and breastfeeding patients?
These kill vaccines globally has been actually used in, not CoronaVac kill vaccine, I mean the kill vaccine technology is safe in pregnancy as well as lactation. However, for the CoronaVac, in both the clinical trials in Turkey and Brazil, pregnancy and lactating mothers were deliberately kept out of the study. So the data is not available, hence they are contraindicated for the time being. As the use of this vaccine progresses in Turkey and Brazil, we know where more than 10 million and 50 million are already vaccinated. The data on use in pregnancy and lactation will come, and that will give an idea of protection as well as safety, and there will be a change in package insert claim later. As of now, it's contraindicated not to be given in pregnancy and lactating mothers.
From Nodiana Shadum, is there any specific buffering time for COVID positive patient to get vaccinated?
Okay, 28 days is an ideal one. After they have been completely recovered, you wait until 28 days and then you can give first dose.
From Patisera, adakah kod QR dan nombor siri akan diberi salinan hard copy kepada PPV? Will QR code and serial number will be a copy of hard copy to the PPV? Hard copy of the copy.
Kod QR yang mana?
Tak apa, nanti kita tanya balik Ms. Patisera, soalan ni kurang jelas di situ. Next question, Ms. Deborah Ngadan. Once received vaccine in pusat pemberian vaksin, how long to finish vaccinating recipients? Is there a time frame? Example, receive 240 vials. When is the last day to administer the 140th vial?
Okay, as of current label approval from NPRA is 9 months.
Gerard T. Melodia, good afternoon. For the transport of the vaccine in rural area, for example in Sabah, will PLSP be using third-party logistic company?
We're going to use mainly majority of the delivery setup is our own facility, but from the outskirt area, yes, we will use a few established transporter which engage as all one. Yes, the answer is yes.
For HB1C uncontrolled but patient stable, is that patient eligible for vaccination?
Yes, of course, HB1C deficient patient can take.
Can you clarify and specify those individuals with uncontrolled severe chronic disease as stated in contraindication?
As I explained earlier, I think I already answered it.
All right, okay. Skip that. Is Stevens-Johnson syndrome a contraindication to this vaccine?
Not in the active phase. Of course, if it's a known case of Stevens-Johnson, you can vaccinate. They are allergic. They have, okay, there could be a low protection, but Stevens-Johnson is not a controlled Stevens-Johnson. It's not a contraindication.
Will Pharmaniaga provide facility with field VMS1 form together with stock?
Yes, inside the immediate packing.
From Sean, do blood pressure and other clinical parameters be measured prior to vaccination in ensuring they are not in the acute phase?
Usually, in a vaccination setting, we don't measure it. But if you have a doubt, I think there's no harm in measuring. If a hypertensive patient comes to you and you feel he's sweating and is breathing heavily, there's no harm in measuring hypertension. It's a old patient, but in a vaccination kind of a setting, if it appears to be normal, we usually don't do it.
From Mr. Jo Tew, is it also stated be cautioned to use in age more than 60 years old patient? May I know what is the recommendation?
As of now, 60 year and old, okay, in the 60-year-old were studied in 2 studies, one in phase 2 in China, where they enrolled 60 up to 89 years of age for immunogenicity and safety. Found to be very safe and as immunogenic as adults. However, in the Brazil study in efficacy, it was done in healthcare workers, so the number of elderly were not that much. I think close to 632 out of total 13,000 population. So when we analyzed as a separate age stratified cohort, the efficacy number is okay, is around 50%, same as the adult, but the confidence intervals were very wide. Of course, the lower level was going into minus because the study was not designed to do age stratified analysis. That is the only reason that this vaccine has been given when you use in elderly as a caution. But now the data from post-approval use in Turkey and Brazil has come in, which has been submitted to Chinese FDA. We will also submit to our NPRA here. There they started this vaccination program with elderly actually, 60 plus, 70 plus, 80 plus, 95 plus. And they have seen the reduction in cases in this population. So there's a strong data coming out now, and that's what will be. But as of now, in the current package insert, that you have to weigh between the risk benefit. If the risk of getting disease is higher, then they have to be vaccinated.
From YST, can you elaborate more on the precaution for those with mental illness or family history of mental illness?
This is a standard precaution for any kind of vaccine because it may lead these vaccines when they are injected. They release so many interleukins and antibodies, and there could be exacerbation of neuritis or some antibodies which can actually damage the muscle, the nerve layers. So people which have any kind of neurological disorder or history of neurological disorder has to be given extra caution and extra monitoring as compared to any other normal healthy adult.
From Mr. Satish, can a person vaccinated with Pfizer vaccine take CoronaVac?
Okay, first dose of these are specified doses. So if you are given first dose as Pfizer, you have to take the second dose as Pfizer. If you have given first dose as CoronaVac, it has to be given second dose as CoronaVac. These are not interchangeable at all.
Sarah Sofan would like to know, is history of severe allergy to food or animal sting or maybe environment also a contraindication to this vaccine?
They are not contraindication, they are caution. You have to be cautiously giving this vaccine to those people who have any kind of allergy history.
From YST, is the observation period same as community 15 minutes or different?
Usually any kind of anaphylaxis happens within 5 to 15 minutes. So if you're observing it for 30 minutes, it's a better window period, 30 minutes. But if nothing has happened in 15 minutes, probably nothing will happen in next 15 minutes also. So what I recommend, I think, is 30 minutes of observation.
From Mi Yi Liao, inactive pemphigus vulgaris patient, last active phase was 2018, totally controlled now and not on any medication. Is the patient a candidate for the vaccine?
Yes, I think they are not contraindicated. It can be given.
Why CoronaVac got mentioned caution in diabetes and neuro patients?
This is a regular caution because these vaccines are given emergency use approval. The clinical trials are still on. So the large clinical trials which have been done in Turkey and Brazil, they showed how much protection you get. The safety part is still ongoing, which will end probably end of this year. So the data is still coming. With the incomplete data on safety, the regulators are cautious and would like to give caution for any kind of comorbidity. So everything which is beyond normal, like diabetes, hypertension, you have to be cautious.
Gavin Yap would like to know, can a person that is tested positive COVID after first dose Sinovac be given the second dose?
Okay, if you are given a first dose of vaccine and then you develop disease, because after the first dose you may not get full protection, then the second dose to be given after complete recovery from the disease, 28 days after that. Or the guidelines on that is actually not clear. CDC and the other governments are working on those guidelines. There could be 2 doses again for these kind of patients. It is not clear how to handle this situation so far.
Ms. Jin Lian Lee would like to know, the CoronaVac vaccine should not be reported in AFI and MySejahtera, or we should report to the SCR manual menggunakan borang ADR using the ADR form.
Untuk vaksin ni, yes, you boleh laporkan AFI melalui MySejahtera. Tetapi untuk healthcare professional, kalau laporkan secara manual, borang manual tu mempunyai section causality, banyak ciri-ciri AFI yang perlu diisi. So I think it's better kalau you isi melalui menggunakan manual ataupun online NPRA's website.
Mr. Abdullah Amin would like to know, based on clinical trial, doctors, what factors that contribute to huge difference in efficacy between Brazil and Turkey?
So the clinical trial, it depends on the population risk. Brazil population was a very high risk population because they are doctors working in the COVID ward and exposed to COVID virus at a very high dose. So when the risk is high, the efficacy goes down. And when the risk is low, the efficacy goes up. That's how the efficacy calculations are done. So when you are, even if you are vaccinated and you are being exposed to a very high dose of infection, you will probably still get the disease and become positive. But the vaccine protects you from getting it severe, protects you from getting hospitalized, and protects you from getting any kind of medical treatment.
From ET, hi, what syringe do you use? Any specific types of syringes, or is the vaccine pre-filled time?
It's in a vial. See, the recommended syringe for any intramuscular injection in an adult of above 50 to 60 kg of weight is 22 gauge to 25 gauge. The length should be 8 by 5 inch, which is roughly 1.25 inch can deliver inside the muscle. That's the recommended, but don't go any thin than 25. It should be ideally 25, 24, 23.
Any pre-dilution required?
No, it's no dilution, fully liquid vaccine. You just have to extract and administer.
From Nur Aniza Osman, after the 200,000 doses, next supply will be in multi-dose or single-dose vial?
The entire supply of this vaccine will be in single-dose vial.
From Ms. Lee, may I know, for the PSV selected, can we distribute the CoronaVac we received to other KK under the same PKD?
For this question is untuk pharmaceutical logistik, kita hanya akan buat penghantaran ke lokasi yang telah ditetapkan oleh Kementerian Kesihatan. To answer the second question, which is CoronaVac we receive can deliver to the KK under same PKD is I believe we need to refer to the Kementerian Kesihatan yang bertanggungjawab untuk pengalihan stok CoronaVac.
From Faiz Hamir, what will happen if we accidentally give Sinovac vaccine to those with uncontrolled severe chronic disease?
If you've given a vaccine to an uncontrolled severe disease, then the disease symptom has to be reported as an AEFI because they are having symptoms. For example, if I give vaccine to a very high blood pressure patient today, and tomorrow he faints, I have to report it as a AEFI. Of course, the analysis part will be separate, but if you give to a uncontrolled chronic disease which have acute symptoms, then you have to report it as a AEFI also.
Correct.
Next one from Fatia Jabir. Do we have to leave the vaccine in room temperature first to acclimatize it to room temperature prior to administration to vaccine?
No need. You take out vaccine, just keep it for 5 minutes and it can be administered at the temperature of 5 degrees. But better you keep it for 5 to 10 minutes because that time you take to actually take out from the box and take out the vaccine in a syringe and then administer.
From YST, any figure on risk of anaphylaxis compared to other COVID vaccines?
The Pfizer COVID vaccine risk is much higher. I'm not afraid, I cannot comment on that, but this one is 1 in million. You can Google the Pfizer anaphylaxis risk, it's available. There was a publication which was made 2 weeks ago, but this one is not published yet. The data from the CDC was discussed with us by CDC China yesterday, and we were going to submit this to NPRA, and probably it will be published soon. It's 1 per million doses.
From Ivory Jing, with regard to this statement, avoid exposure of CoronaVac to a disinfectant, what about the aseptic technique practice of swabbing the vial stopper?
If you are swabbing the vial stopper, just wait for a few seconds to evaporate. So these any disinfectant you want to use to rub the vial stopper, it will take only maybe maximum 5 seconds to evaporate. So if you're doing it, just wait. But if you're not doing it, still okay.
From Kenneth Lim, will Famniaga be providing VMS parent QR code for each of the packing of the CoronaVac?
For this vaccine, each immediate pack they have their own code. So and then each inside the in the immediate pack have a barcode for each own. So yes.
Should we check patient BP and sugar prior to Sinovac vaccine to identify who is having uncontrolled DM-HPT? What if it is a mass vaccine program? Look like it is not feasible to do so. Should we check patients' BP and sugar?
No. Okay, no need for any vaccination program. You only check by verbal history of the acuteness of the chronic disease. No need to check. But if you feel by verbal examination and verbal look and physical look that they may need some kind of examination, I think it's better to do it.
From Sun Hong Fo, the trial is 0-14 days, but you mentioned recommended ideal regime is 0-28 days. Any official statement for it?
It's in the package insert stated because when they were tested for immunogenicity, which we all agree that they are indirect correlate of protection, it has shown a much higher immunogenicity, both in terms of ELISA and neutralizing antibody titers. So the efficacy studies were 0-14. It was scientifically very clear that if you vaccinate at 0-28, which has been done in the efficacy studies also, if longer is the duration between the first and the second, the higher is the protection, also seen in Brazil as well as in Turkey. The recommendation is you can be given any day from 14 to 28, ideally 28. But I think KKM will come up with a statement soon, probably 21 days. We are not sure about that, but if you ask me, and 28 days is the ideal, and anything between 21 to 28 is okay.
Ms. Nandu Nandini would like to know, is the needle and syringe provided as well, or should be purchased separately?
Should be purchased separately. It's not provided. We only for this vaccine, we supply the vaccine itself.
From Sri Vikna, diabetic patient with poor HbA1c, what are the effects if they still continue for the vaccination?
Okay, HbA1c level is not an indicator of acute phase. It is just an indicator that you have uncontrolled diabetes. It could be given, yes.
From Joe Teo, if the person gets pregnant after the first dose, what is the recommendation for the second dose?
Okay, pregnancy is contraindicated because we don't have any data on the pregnancy for safety and also for efficacy. However, the vaccine has been extensively tested in animal reproductive studies. So there were 2 species of animals who were given vaccine before copulation, at the time of fertilization, and post delivery, and they were not found to be any reproductive toxicity effect. In theory, the vaccine will have no genotoxicity or reproductive toxicity. Somebody has inadvertently taken and got pregnant, it has to be reported in AEFI and the second dose to be given as per plan, but the patient has to be monitored. No need to terminate pregnancy, no need to not to vaccinate with the second dose.
Ms. Yap would like to know, is HIV patients with CD4 less than 200 contraindicated for CoronaVac?
Of course, in any immune disorder, including HIV, the vaccine will definitely not be as efficacious as in normal healthy adults. It's not contraindicated, but it has to be given with precaution because we know the efficacy will be less. But how much, we don't know. That studies are still ongoing on HIV immunocompromised.
From Ms. Srivigna, any study about safety of vaccination among poor control chronic disease patients?
Poorly control is okay. It should not be in the acute symptomatic stage of chronic disease.
Nur Azliah Ahmad Zainuri would like to know, women plan to conceive, can they get CoronaVac?
See, if they are planning and if they are not pregnant, they can take CoronaVac. But if they are pregnant, it's contraindicated for now. Very soon, by the end of this year, we will get the data of use of vaccine in pregnancy. And what are the early indications is it could be probably used. So if you're planning to conceive, it's not, you can still take. But if you're pregnant, you should not take.
From Patisira, let's say patient got first dose of Pfizer vaccine, however, due to no stock, he needs to take CoronaVac. Is it allowable? And if patient want to take CoronaVac, any time frame from the last dose injected with Pfizer before take CoronaVac?
See, the interchangeable studies has not been done, but we know now that these studies are being planned in US between the 2 vaccines which are available there. They cannot be interchanged. If you have taken the first dose of Pfizer and you cannot take the second dose of Pfizer for any reason, and you want to take a different vaccine, you have to take 2 doses of that vaccine. Could be any vaccine, it could be CoronaVac or any other vaccine. So hypothetically, if you have taken a Pfizer and you cannot take and complete the second dose, you should complete your vaccination course with a different vaccine as a complete course. So 2 doses of CoronaVac. As we say for any other vaccine, that from the last taken vaccine, you should have at least 28 days in between, because based on the antibody kinetics, they will start going down from 21 to 22 days onwards. Minimum 28 days interval between the last vaccine.
From Mr. Joe Chu, Pfizer has specific contraindication to PEG, bisorbate. May I know what is the specific active ingredient in CoronaVac to identify in individuals who are hypersensitive?
Polysorbate is not there in CoronaVac. CoronaVac has normal regular buffers, sodium, bicarbonate, and a few other salts, and a virus which was killed. Polysorbate is a non-allergic material, whereas the salts, regular buffers, salts are not known to be allergic. So this vaccine has no polysorbate.
From JKWPLK, PKL and P, untuk yang perlu diberi warning and precaution, should it be given in hospital setting or if clinic setting is enough?
I think warning and precaution is clinic setting is enough. No need to be in a hospital setting, but the clinic should have all the precaution to address any kind of hypersensitivity or anaphylaxis, any immediate reaction after vaccine.
From IPC, adakah kad vaksin is the vaccine card will be provided to the PBV.
Yeah.
From PK Manjung, apa yang dimaksudkan dengan uncontrolled severe chronic? I think kita dah jawab soalan ni beberapa kali. From Mr. Tan and Sheng, fact sheet CoronaVac boleh didapati daripada mana? Where we can get the fact sheet of CoronaVac?
Fact sheet will be given together with the package inserts.
It's part of the packages. So from PKG Mandung, satu vial berapa dos? Jawapannya satu dos tadi. From Muhammad Zehan, ini adalah link. Okay. From one user in the Zoom, what is the longest interval between first dose to the second dose? If client had difficulty to be vaccinated at day 14 until day 28.
The maximum allowable window, which was tested in the clinical trial, is 28 plus 7 days. However, you try to give it less than 28 days, any day between 21 to 28.
From KKM Masjid Tanda, good morning. May I know, is ESRF patient safe to take the vaccine?
Yeah, which patient?
ESR.
ESR-free. I'm unable to know the full form of ESR, but anyway, we'll go. I'll find out and get back to this.
European Synchronous Radiation Facility.
European?
Yeah. We'll pass to the next question first. Do we need that first, the vial of vaccine after taken out to room temperature? From Muhammad Zihan.
We need to thaw. No need to thaw. Just keep it outside for a few minutes and then you can.
The ESRR is end-stage renal failure. Sorry.
Yeah, end-stage renal failure on dialysis with controlled creatinine can be given. Yes, of course.
All right. Next one from RPC. Can patient with bleeding disorder or on patient on anticoagulant with acceptable INR can receive the vaccine?
Yeah, it said that anyone who was on anticoagulant has to be with caution for any of the vaccine. You have to make sure that the platelet count is not that low and there's no bleeding after vaccine. So you give it with very caution. There's no contraindicated for somebody who is on immunotherapy or anticoagulant therapy.
From Muhammad Zihan, do we need to thaw first vial of vaccine after taken out to room temperature?
No need to keep it specifically for any particular time. You take it out and you start preparing. By the time you will be administering, it will be at least 5 to 10 minutes, and that temperature is okay to be administered.
Will vaccine become positive RTK or PCR after vaccination? From Hospital Shalam.
PCR, of course not. But yeah, you can test from rapid antibody testing from the blood. If they will be positive, I think after 7 days, you will start seeing it, and the peak comes at around 40 to 17 days.
Next one from Psycho Penang. What is the cutoff point of HbA1c recommended by Pharmaniaga before administering CoronaVac?
HbA1c, as I earlier said, is not a marker of acute phase of uncontrolled diabetes. It's just a measure of control of diabetes. So whatever it is, irrespective of that, if it is not in ketoacidosis, very much no symptoms of high blood sugar, you can easily be given the vaccine.
What is the cutoff point of BP control before administration of CoronaVac recommended by Pharmaniaga? Any precaution of for anticoagulants? What is the suggested pre-medication for those with history of anaphylaxis, for those with history and severe allergy with previous vaccines?
Okay, any allergy, severe allergy, anaphylaxis symptom, there's no need for pre-therapy or steroid or anti-allergy for before vaccination. They just have to be observed with caution. You are asking for any BP control, okay? Okay, the patient is having symptoms for severe BP, which is diastolic above 180 and systolic above 100. You should have to observe and then then and if you see and then you measure, so it's not recommended to measure BP of everyone. You just have to see if they are having some symptoms of being uncomfortable and they are history of hypertensive, and you check with very high severe category, then you postpone the vaccination and tell them to come back. But as such, there are no guidelines, clear-cut guidelines. Is the healthcare provider decision at that time whether they may need some sort of. See, the reason we would like not to vaccinate if they have any other symptom is that once you vaccinate, and if they have a symptom or a comorbid disease which will cause some kind of reaction later, it will be attributed to vaccine. Then it will be difficult to differentiate whether it's because of vaccine or whether he was having some kind of symptom before the vaccine, which only got noticed after the vaccine was taken. So we avoid any vaccine which is new to be given at that point when there are other evolving symptoms which are probably acute phase of any chronic disease. There's no predefined cutoff for any disease for vaccine as such. It's a doctor or healthcare professional discretion at that point. If he finds the patient to be suitable for vaccination and is not in any acute stage or any symptomatic stage, it can be safely given.
Dr. Chong would like to know and to confirm how long the vaccine can be kept in 2 to 8 degrees Celsius. Do we need to thaw the vaccine? Once taken out from the fridge, we should keep it in the 2 to 8 degrees as well.
So 2 to 8, it can be kept for 9 months. Once you take out, the recommendation is to use it on that day itself. Don't put it back, use it that day, because that data of putting it back in 2 to 8 is not available yet. If you have taken out, it can stay at 25 degrees for a long time for that whole day. So in ideal situation, whatever you have planned for vaccination, you take little less than that doses and then vaccinate. And if you need more, you take out more and vaccinate, because there's no reconstitution required and you don't have to prepare. It's better to keep it in 2 to 8 and then take it out before vaccination.
Should loaded volume 1 ml syringe be used or normal APPL syringe can be used in administer vaccine?
Use any syringe below 2 ml. It's easy to titrate 0.5 ml of dose. 1 ml also you can use, but the ideal is 2 ml syringe.
What about breaking of cold chain during transport? Immediate use of the vaccine, or how long the vaccine can last in room temperature?
The vaccine can last in room temperature up to 56 days. Room temperature is air conditioned temperature 25 degrees. The vaccine can also last up to 14 days at 37 degrees Celsius. So, but if you happen to break a cold chain at your site, you immediately inform us, then we can actually get back to you whether the vaccine is usable or not.
From Sipitang Hospital, is it safe to be given to G6PD patient?
Yeah, of course.
All right. And from Samarahan, would like to know, after the 2 doses of CoronaVac, do patients need a booster in the future?
The booster study is ongoing. All the vaccine recipients in phase 3 study, they are being followed up for 1 year for antibodies, and at the end of 1 year, they will be subdivided and given different dose of boosters. That study is still ongoing. We don't have the data yet. It will be available by end of this year.
All right, we're going to take about 10 more questions. Donival Tam would like to know, what is the specification of the needles and syringe to use CoronaVac? Is it 21G to 23G needles?
Use anything 22 to 25. 21 can also be used, but it's a little thick, so there could be a little bit more pain, but ideally it's 22 to 25. There's no low dead space syringe required for this, because we are filling around 10%, 20% higher in the vial, so you can easily take out 0.5 ml.
Can a patient with history of allergy to Pfizer vaccine change to Sinovac?
Usually any allergic patient, whether to Pfizer vaccine or any other vaccine or food, can be given this vaccine, but it has to be given with caution.
Yep, Shi would like to know, what if patient missed the 2nd dose after recommended time interval? Do they need to repeat the whole course from the beginning?
Okay, that data is not available. But if you miss the second dose, the recommendation is you give as early as possible.
Ms. Hua Chuyan, will PLSP inform facility when will the vaccine deliver? I mean,
Yes.
the exact date.
Yes, we will inform the facility the exact date of the delivery.
Is CoronaVac safe in patient above 60?
Yes, of course, safety has been already established in phase 2 study in China. Also, phase 3 has been established in around 600 plus subjects in Brazil. There has been extensive data of use of vaccine in Turkey, in Brazil, in Chile, in Indonesia, above 60 years of age, who started with this elderly vaccination even before the adults. And that data, post-vaccination AE5 has already been collected, so safety has already been established. The only missing piece is the statistically significant protection in this age group, which was not there in the Brazil study because it was not designed for that particular age group at that point. Safety-wise, it's definitely established.
Satish would like to know if control entirely to be given under government facilities or available for purchase for private sectors or GP.
That discussion is ongoing with the Ministry of Health and KKM and MOSD. As of now, it will be under government vaccination program only.
Any stability data of if cold chain broken?
Yeah, so vaccines has to generate accelerated stability. I just showed in the slide, 14 days at 37 and 56 days at 25 degrees Celsius.
Mr. Vector from PKD Nursing would like to know, can we change PPV site for this vaccine and who to contact?
At this moment, we have received the list, but PLSB is not the site yang akan boleh buat perubahan. Saya cadangkan pihak PKD Mersing untuk berhubung dengan pihak BPF ataupun urusia yang menyelenggara vaksin COVID-19. Ya.
Encik Zulhalhidi Yusof ingin tanyakan, merujuk pada cold chain card yang digunakan, bagaimanakah indikasi untuk menunjukkan jika vaksin tersebut telah freeze kerana suhu excursion menunjukkan hanya 8 darjah Celsius saja.
Untuk makluman proses validasi kotak form box yang kita gunakan, ia tidak menunjukkan penurunan suhu selepas buat precondition untuk buat packing di bawah suhu 2C. So bermakna berkemungkinan is confirmed that there will be no freezing scenario untuk pembungkusan vaksin tersebut.
Ms. Chidori, acute chronic situation, any clinical parameters guideline?
As I said earlier, there's no defined guidelines, but it's based on the discretion of healthcare provider.
Mr. Joe Thieu would like to know any mortality cases reported in CoronaVac.
In the clinical trial, there's no severe case reported. Of course, in the post-vaccination, where 11 million has been reported, there are severe cases which has been reported, but none of them attributed to CoronaVac so far. I think there's a question about what happened if the patient with uncontrolled glucose, right? Was this one about receive the vaccine? Okay, you know, I said earlier, any kind of uncontrolled chronic will result in some kind of symptom after vaccination, which will be difficult to differentiate between vaccines. That's why any symptomatic stage of a controlled disease is advised that you defer, especially for a vaccine which are given emergency use approval or disaster use approval like the one NPR has given, where the full data has not been established. It's better to avoid giving vaccine when there are other existing symptoms.
From Azlina Matar would like to know, what happened if the patient with uncontrolled glucose level received the vaccine? Okay, sorry. Next one from Roslina Wati. Is it safe to give this vaccine to RVD patient?
Okay, then we'll come back to this. Google RVD.
RVD is retroviral disease.
Retroviral disease? So basically retroviral disease, recovered from retroviral disease, yes. Yeah.
Next one, can patient with autoimmune disease be vaccinated?
Patient on autoimmune disease must be taking some kind of medication, and and they can be given if there are no signs and symptoms of disease at that point. But of course, the efficacy has not been demonstrated in these subjects. It could be lower than expected.
All right. When will CoronaVac release its data in journal?
So the adult and the elderly phase 1 and 2 data are already published from China. The other two completed studies are from Institute Butantan, Brazil, which is under right there. It's a very renowned institute in Brazil, 120 years old. One of the biggest institute of medical research in South America. They are writing up the paper and will be published soon. Turkey study was completed later, and by 3rd of March, they will also be publishing definitely. It was done by a university, so that publication can come up earlier.
All right, I'm going to take a few last questions. The last one would be from Ms. Chidori. Is duration for use finished China product and fill and finish in Malaysia same? If not, what is the duration for Malaysia fill and finish product?
So in Malaysia, we have already initiated the fill finish process. The bulk is imported as ready to fill bulk. So we are not making any formulation here. We are importing the bulk, filling in vials and releasing it as per the potency guidelines from NPRA. We are only importing until we are ready and get approval for the fill finish product from Pharmaniaga. I think it will probably start from May onwards. But the vaccine indication, precautions, everything will be the same because we are using ready to fill bulk without any change in formulation, composition, presentation, contact material for the vaccine, which is filled.
Okay.
Right. We come to the end, please.
Bagi pihak Pharmaniaga, kami mengucapkan ribuan terima kasih kepada Kementerian Kesihatan Malaysia kerana bersama kami selama sejam setengah sesi soal jawab dan penerangan tentang COVID-19 vaksin keluaran pihak Pharmaniaga dan CoronaVac. Saya rasa dalam perbincangan tadi banyak persoalan yang telah terjawab, tetapi jika masih ada persoalan-persoalan umum ataupun persoalan-persoalan spesifik, sila kemukakan soalan melalui email. Kalau soalan-soalan umum, boleh di-email kepada comms@pharmaniaga.com, ya. comms@pharmaniaga.com. Itu kalau soalan berkaitan tentang umum. Tetapi jika spesifik berkaitan dengan pharmacovigilance, boleh tulis terus kepada Drug Safety Unit, DRUG SAFETY UNIT, Drug Safety Unit @pharmaniaga.com. Okey, dengan itu bagi pihak Pharmaniaga sekali lagi saya mengucapkan ribuan terima kasih kepada warga KKM Malaysia. Terima kasih. Assalamualaikum.
Okay, thank you.